Welcome to our aging puzzle. I am your host, Carlette DeVoe. Our show is about aging and how it affects all of us. Remember, we are going to be having conversations with guests from all walks of life that have been impacted by life and aging. It doesn't matter if they're seniors, if they're middle aged, if they're young folks, that's okay. We're going to bring their stories to you. We will have the opportunity to listen to stories that are definitely going to move you, move me, move all of us to tears. They're going to make us laugh, they're going to inspire us, and they are going to give us such valuable insights on various topics and health problems and ways to live longer and healthier. We are looking forward to having an inspiring time of listening, learning, and having fun and just connecting with each other. So remember, this is October, and we all know October is Breast Cancer Awareness Month. So you're going to see pink ribbons around to remind us of the importance of breast cancer awareness. These ribbons are a great reminder for reflection and healing, and they're dedicated to bringing awareness to breast cancer diagnosis and treatment. It's also an opportunity to celebrate survivor stories and remember the loved ones we have lost. Now, while it can be difficult for us, it can also be a time of healing and reflection. Because during the Breast Cancer Awareness Month, this is an opportunity to give us time to share our experiences, to help each other, to inspire each other. It's also going to give us an opportunity to hear from our guest for this month, who is a dear friend of mine. She has gone through the battlefield of breast cancer. My dear friend, Dr. Michelle C. Powell, is here this month. She is going to open up about her very own recent breast cancer diagnosis and how she went through this journey. And hopefully, we'll be able to help and inspire patients, survivors, caregivers, and everyone else who has been affected by breast cancer. Now, remember, this show, we have one guest a month, and that guest walks us through their journey. The first week, we're going to hear about their big reveal. How did they hear the news? What happened? How did they learn? How did they feel? How did they tell their family? And how did their family feel? And then week two, we're going to talk about and just really focus on the treatment options. What options were they given and why? And then the third week, we're going to hear about the actual treatment. Like, was it effective? Did you have side effects? Really, what happened? What was it like? And then week four, we want to hear, okay, you've gone through all of this. You've told your family, you've gone through the emotions, you've gone through treatment. What's going on now? How you doing? How you feeling? And what are you doing differently? So we're going to hear everything from our guests. So we are taking you through their journey week after week. And that, we hope, folks, will help one person out there who is going through something just like our guests. Now, every week, remember, we talk about aging facts. So I'm going to go into aging facts right now because it's important because we're all aging. We all are aging, unfortunately. Some of you are younger than others, but that's okay. Every day you get a little older. Now, when it comes to our health, we want to know, does food and exercise really impact our health, or does it have an impact in any way on any types of cancer? Well, the American Society of Clinical Oncology has reported that obesity, yes, folks, obesity is becoming the main preventable cause of cancer. It's almost superseding tobacco. Really? And obesity is a key factor in the cancer rate in our country. We are overweight. We've got to pay attention to what we eat and how we exercise, how we move. So healthy eating and exercise are extremely important for maintaining good health. Listen, I am not perfect by any means. I struggle with weight too. So that's why I'm here to say we have to pay attention. Being overweight and not exercising is not good at all. Actually, studies have indicated a potential link between regular exercise and a reduced risk of breast cancer. So therefore, regular exercise helps reduce the risk of obesity-associated diseases, including cardiovascular disease, diabetes, and many types of cancer, including breast cancer. We have got to watch what we eat and we have to exercise. And surprisingly, even the food we eat when we're younger can have an effect on us in our later years. Researchers have also shown that being overweight early in life increases a woman's risk of benign breast disease, which can increase her chance of breast cancer in the future. What we eat and how we care for ourselves is important, people. Yes, it is. Ah, but the good news, studies have consistently shown that lifestyle changes can be made to decrease your chance of getting breast cancer and improve prognosis after a diagnosis. It is estimated that up to 30 to one-third of breast cancers can be avoided. And there are also certain things that we as people can do to make sure we keep ourselves healthy and safe. So, guess what, folks? You hear me say this all the time. I'm saying it again because it's not me, it's the researchers and all those smart scientists is telling us to do this. Okay. First, eat and maintain a healthy diet. Here's a quick list of superfoods that are recommended to incorporate into your daily diet. You may not like them, but this is what they're recommending. Broccoli, arugula, kale, flax seeds, berries, apples, and green tea. Yes, nobody really likes them, but they are good for you and they are healthy superfoods. And the number two thing they recommend, exercise regularly. Doesn't have to take much. Something simple like going for a walk after dinner. Just go for a 30-minute walk after dinner. It's going to help. Number two things they recommend to reduce your risk of certain types of cancers and to maintain good, healthy life. Eat healthy and to exercise regularly. Come on, guys. Let's stay healthy and age gracefully. Yay! I'm having a good time. We're going to eat better. We're going to eat better. And we're going to age gracefully. Come on, guys. We got to do this. We got to do this. We got to do this together. Okay? Yep. So, our topic for this month is breast cancer awareness. Since 1985, we observed Breast Cancer Awareness Month every single October. We've been doing this since 1985. It is the month that's dedicated to raising awareness and a great reminder of the impact breast cancer has on our society. Research, early detection, and prevention are all very important. And during the month of October, it is important to come together as a global community to focus our attention on this disease. So let's start our conversation with why it's important to perform self-breast exams. By now, you'll likely know that self-breast exams are extremely important. However, if you're feeling guilty or tuning out because you're feeling guilty, we're not here to guilt you. We want to encourage you to do self-breast exams. Women should perform self-breast exams regularly, as 25% of women who found their breast cancer did so through their own self-examination. And you will hear from Dr. Michelle C. Powell that is how she learned that she had breast cancer, through her own self-examination. And it was at stage 3. You're going to hear her story. It is important. Now, it's not a clear-cut way or a clear-cut number of times you need to check your breast for lumps. There's no number that says you have to do it once a month, you have to do it every week. Not really. You know, there are some healthcare professionals who believe that self-examination is really not necessary. I'm not a healthcare professional, but I can tell you my dear friend, Dr. Powell, found her cancer through self-examination. So I'm an avid believer in self-examination. But some doctors actually do recommend monthly self-exams. The National Institute or the National Breast Cancer Foundation suggests that you do self-breast exams. Even if you don't think it's necessary, do it. Just try. It's important. You have nothing to lose, a lot to gain. When you're in the shower, examine yourself. You know your body better than anyone else. Go in the shower and check for lumps and for any abnormalities. Again, remember, this is free. You can check to make sure you are okay. If you have questions about breast cancer, you can visit breastcancer.org. And they also suggest that doing self examination is the best way to feel your breast since it's easier when your skin is wet and slippery and you're in the shower. It's easier to check your breast and check for any abnormalities. So, one thing to remember, all breasts are not the same. Some have lumpy, some are not, but check your breast. You know your breast better than anyone else. Young women in particular, you have to remember that your breast may be lumpy, bumpy. That's okay. That's normal. If you have dense breasts, trust your intuition and don't panic. Just go and check with your doctor. And that way you don't have to be worried. Okay. Again, self breast examination is important. Go ahead, ladies, do it. Check your breast at least once a month in the shower. Now it's time to welcome our very special guest. She is none other than my very dear friend, Dr. Michelle C. Powell. Yay! Behold the grace and wisdom of my dear friend, Dr. Powell. She is actually a board certified osteopathic family physician with over 25 years of experience. She emphasizes lifestyle changes for long term positive outcomes and frequently addresses hypertension, diabetes, and obesity in her practice. She is actually the founder and CEO of Powell Health Solutions, which delivers affordable and quality preventative health care with a holistic approach. She is a very popular lecturer and spokesperson who challenges thinking and behavior to achieve better outcomes. And despite being a breast cancer survivor, Dr. Powell has had to implement her own teachings when 2 years ago she was diagnosed with stage 3 breast cancer. Today, she is thriving. She is a survivor, and she shares her experiences around the world to women and families with the goal of helping to improve and positively impact breast cancer survival among underserved communities. Her patients describe her as compassionate, knowledgeable, and dedicated healer who is committed to their well-being and the betterment of all. The magic of Dr. Powell's touch is a testimony to her unwavering pursuit of excellence in the art of healing. So please join me in welcoming my very dear friend, Dr. Michelle C. Powell. Well, welcome all. I have my very, very special guest, Dr. Michelle C. Powell. I will tell you that Dr. Michelle Powell's story is going to move you and inspire you. The goal of talking about breast cancer is to ensure that we help one person, because everything that you do to take care of yourself will bring you closer and closer to maintaining longevity and life. So Dr. Michelle Powell is going to share her story about her breast cancer journey. This week, we're going to talk about the emotions. You know, I will tell you that you'll see Dr. Michelle Powell here. She is one of my dearest, dearest friends. I love her dearly. We've known each other for 20, 30 years. Yeah, a very long time. And she's going to share her journey, but I will tell you that we went through this journey together. And when you hear her story, please remember, if you haven't gone to get a mammogram or to do self breast examination, please do so. It is extremely important. Dr. Powell, let's start off by having you tell us about the first mammogram that you went to, and why you went for that mammogram, and how did you find out that you had breast cancer? Walk us through what that looks like. What happened?
Well, thank you, Corlette, for helping me to bring the story to more viewers and to cast more light onto breast cancer awareness. And I like to think of breast cancer action. I liked because I'm doing this because I want to see more women and men take action to reduce the deaths from breast cancer, especially among minority populations. So, in answer to the question, is my first mammogram. I will say that I've been doing mammograms from the age of 40. Just as recommended, every year I went to for my mammogram religiously, and I will take you back to September of that 2021 when I did my routine mammogram and was told everything was fine.
Wow.
Everything was fine. And I said to them, hey, I usually do an ultrasound. And for people who don't know, sometimes if you have really dense breasts, that's thick breasts, they recommend that you do an ultrasound with your mammogram of your breast. And so I said, great. See you next year. And then I didn't pay much attention to it and moved on with my life as a physician. In about November of that same year, I noticed a lump. I felt a lump in my right breast. And I thought, I'm not paying no mind to that because my breasts are lumpy and they're always lumpy.
Right.
Yeah.
Wow.
And December, the lump was still there. And I'm like, it feels a little harder and it doesn't seem, my breasts are always lumpy.
Wow.
Again, not paying attention. And in January, it was still there. And my partner says to me, excuse me. My partner Darwin says to me, are we going to do something about this? I said, well, I have lumpy breasts. And, by this time, I'm like, this is getting kind of big. And we're looking from September to now. We're in February when I could get an appointment to get a ultrasound of the breast, because now I'd already done a mammogram, and your insurance won't pay for an additional mammogram if you've already had one. So we went and I did a ultrasound, and at that time the technician said to me, hey, I don't like how this looks. I think you need to do a biopsy of this breast. Now, the minute she said that to me, having been a doctor, Corlette, I'm like, here we are.
Yes.
Here we are. The words that no woman wants to hear. There's a mass in your breast and it doesn't look good.
Mm-hmm.
And I'm thinking, this is going to suck. This is not good. And unfortunately, when you have that professional hat and you've been through it and all the things that happen, I thought I knew all the things that happen, I'm thinking, dog, I got to go get a biopsy. So I immediately called a friend of mine, Karen, who has had multiple biopsies. And she was like, you're going nowhere else except to see Dr. Harris. He's the best. He's the best. And so I called up and he didn't have any openings. And so I said, hey, Karen, he doesn't have any openings. And she goes, did you tell me you're a doctor? You tell Dr. Harris you need to get in there.
Mm-hmm.
And so he did get me in for the appointment. And she says to me, Karen once said, how did you get in before I got in for mine? And I said, you gotta have a little.
Because you're a doctor and you're special. Did you tell her that? No.
So I fast forwarded. So I did schedule with Dr. Harris. He reviewed the films and he said, most definitely we have to do an ultrasound guided biopsy of the mass that was there. By now, the mass was 4 by 5 centimeters. When you think
It was
about
growing rapidly. It was growing.
Yeah, it was a small, about the size of a tangerine, a tiny, tiny tangelo,
Mm-hmm.
and it was hard, it was firm, it wasn't moving, and it wasn't painful, but it was there nonetheless. You could feel it. And so,
Yep.
yeah.
Before you go on, Dr. Powell, what I want to go back to is the astounding revelation that you said that you had a mammogram previously, in
6
September.
months.
You
Yeah.
had a mammogram in September. You felt the lump in November, and then you took it upon yourself to pursue getting an ultrasound.
Yep.
So listen, the average woman out there, when they go and get a mammogram, the mammogram says I'm okay, I'm good for another year. We don't necessarily do the extra examination at home. And if we do feel something, like you said, I have lumpy breasts. Oh, it's just another lump.
Correct.
How do we help women understand that any little thing, and you're a physician, you went through this, you said to Darwin, I have lumpy breast, I'm just going to leave it alone. And he kept pushing you.
Yes,
It happens to all of us.
definitely.
And if that didn't happen, you would not be at the point where you actually went because he pushed you.
Yeah, he said, I said I kept pushing it off, putting it off because unfortunately, as a physician, my brain's like, this can't be good. When you're in med school, you think you have everything. So already I knew when there was a lump there, I got it. I got something. You just go immediately fast forward to the worst case
So,
scenario, because
right.
you
Self-diagnosis. Every diagnosis, you're like, okay, yeah, maybe that's me.
yeah. So,
Yes.
but you're so right, Corlette. The average person, you get a normal mammogram, and that's the end. I don't need to do anything for another year or two or three. Unfortunately, my medical practice as a family physician, I have had too many women who have not done their annual mammogram, even in the presence of family history, only to find out after missing 4 and 5 years of doing their mammograms, being found with a breast cancer that is well advanced.
Wow, wow. So going through this, Karen is telling you go see Dr. Harris. Okay, so we go see Dr. Harris. Dr. Harris does the biopsy. What comes back when he does the ultrasound biopsy? What comes back?
So I'll take you through the experience of doing a biopsy. So when
Mhm.
you go and do a biopsy, and this is something they really don't tell you, oh, you're going to get a biopsy. Well, ladies, okay. A biopsy means someone is going to stick a needle into whatever it is they're going to biopsy. Biopsy means take tissue. And so they're going to put that needle into that area and take tissue out of it.
Mhm.
And when they say they're going to do it by ultrasound, they're going to use an equipment to find where it is they need to put that needle. And sometimes, and I'm going to tell every woman out there, if they say they're doing a biopsy, you make sure they give you some numbing medicine in the area. Because I've heard many women do biopsies on their breasts and we're not giving any kind of numbing medication for the area. And they can give you what we call local anesthetic to numb the area because they are putting a needle into that area. And in my case, they took not only biopsies from my breast, but they also took it from other areas around the breast because by ultrasound, it showed that it had spread into other areas, what we call a lymph node spread. So they lay you on the cold table, they get the ultrasound machine, numb the area up, and then they put a needle with the medication in it to find, they do what they call localize. They find it on the ultrasound and then they inject that breast and then they suck out the tissue into a syringe and they send that for biopsy. And let me tell you, on the scale of 1 to 10 on pain, it's like getting your blood drawn. So it's not excruciating, kill you pain, but it's not fun because you're laying on a cold table and if you're cold easily, most of these diagnostic centers are freezing. I tell you through this whole journey, I had to get used to being cold all the time because for
Yeah,
some reason they're trying to kill every bacteria known to man in all these diagnostic centers.
that's the way it works. They make sure it's freezing cold.
Freezing.
Absolutely.
Yeah. So they did the biopsy, and the worst part, Corlette, is the wait. And my biopsy was rushed, and it took a week. I had to wait an entire week before I would know exactly whether this was what we call benign or it was a cancer, right?
Right.
Benign means it's just a ball of nothing taking up space versus a cancer, which is a bunch of cells that are growing beyond where they're supposed to grow and trying to spread and cause damage to the rest of your tissues in the area and sometimes other places in your body. 1 week. And so for me, that week I spent it just trying to be the busy doctor, the busy bee, working long hours till I'm tired, going home so I wouldn't have to think about what the possible diagnosis was going to be. And everything in my gut had already told me that this was going to be a cancer.
Yeah. So obviously you kept yourself busy. You didn't want to think about it because if you thought about it, then you would get yourself anxious and, keeping busy, you're avoiding it. So when they told you a week later that, what the results were, tell us about the results and tell us about your reaction, what you did, how you felt, how you shared this information with your family and your friends. Tell us about that because I know every woman that has gone through this, um, some of them have freaked out, some of them have gone through it, in so many different ways. So tell us about your journey and how you handle this and your emotions and how you felt.
I think well, when I was like, I got the call, hey, come on in, let's get the results. My good friend Karen and my fiance Darvin, they insisted on going with me. I'm like, oh well, good. I can go by myself. They're like, no,
No, you
no,
can't.
no, no, we're going. We want to know. I think they
Mhm.
were afraid I wasn't going to tell them, so they wanted to be there. And so my friend Karen had her biopsies done also. And so she said, I'm going to because I'm going to get my results. And so when we both got there, she was insisting on to the doctor, well, what's the results? What's the results? And I'm sitting quietly, and he has some student interns working with him. And he looks at her and he's like, I'll give you yours first, you know? And the minute he said that, I had already knew that he wanted to have a nice long sit down with me about the results and the look on his face. And sometimes you guys think doctors aren't human, they're not real people, or somehow they're above feeling emotions. And it's so not true. I could tell on his face that he was very unhappy about the results. And I could feel in his spirit, you know.
Mhm.
And he was telling my friend Karen, I'll get to you, I'll get to her, give me 1 minute. Just go wait in my office. And I sat and waited in his office. And before he said anything, I told him, I said, this is cancer, isn't it? And he goes, yes, it is. I said, yeah, I had a feeling that was the case.
Mhm.
And my fiance and my friend Karen, they busted out in tears and they were crying. They were feeling more about it than I was. And I guess in many ways, that week leading up to it, I had almost come to terms with what the diagnosis was going to be, not being pessimistic, but um, ladies, if you don't have a mass in your breast and in 6 months there's this big mass and it continues to grow, it's not good. And it's time to move on to what are we going to do. And I guess I was feeling I kind of resolved, like, okay, this is what we got here.
Mhm. Mhm.
What a freaking bummer. I had so many things I
Mhm.
wanted to do this year, including get married,
We're still working on that, but let me ask you, when he told you, what stage was it? And
It was stage 2, 3 with mets to the lymph node, meaning it had moved into my lymph nodes. And it's not good when things move into your lymph nodes because it's like a train track, lymph nodes. Once something get on that train, it's so easy to take the tri-rail all the way to the rest of your body. Yeah, it can move very fast. So we had to move pretty fast for treatment.
so it's stage 2, 3. Let's take this conversation back to other women out there who, one, may have missed mammograms, two, may have felt something or may feel something in their breast and ignoring it. Please, ladies, don't do that.
No,
As you can hear from Dr. Michelle's story, Dr. Powell's story, she had a mammogram. A
every
couple
year.
months later, she felt a lump. And if she had not gone in those 3 months to get an ultrasound, the diagnosis would be different. It was already stage 2, 3. There's only 4 stages.
Correct.
So this was serious.
Very
You
sad.
know, the scary part here, Dr. Powell, is it's so easy for us to overlook ourselves. We don't take care of ourselves. We take care of everyone else.
So true. So
We
true.
have to figure out how to make a difference and help women understand that they have to take care of themselves.
Yeah. You know, Corlette, I had for many years, and I'll tell you a story, for many years, I had been an advocate for breast cancer awareness. I belonged to an organization called Ladies Night Out, and we every year we raise money for women going through breast cancer because the insurance will pay for your treatments, they'll pay for your doctors, but they don't pay for things that are really significant to making you function well, like house cleaning, groceries, even just the essentials that you'll need. Um, and I was giving talks for so long, and and looking back, I was like, wow, I was giving talks for myself, giving the talks up to
Absolutely.
myself and the experiences that I would later on have for my own. And it's one thing to speak, to advocate, and it's another thing to speak from experience and advocate. And
Absolutely.
having it been so personal. My mother, sister, my aunt had breast cancer. I had two other cousins who had had breast cancer. My mom herself had stomach cancer and colon cancer. We've had lung cancer in my family. If there was no IBs, no high blood pressure, but our family seemed to have had multiple forms of cancer, including breast cancer in a first degree relative like my aunt
Mm.
and two cousins. So it was not surprising. But of course, nobody wants a diagnosis of cancer. But
No, very,
yeah,
very difficult diagnosis. And with that diagnosis, what was your emotions? How did you feel? You know, what were you thinking? What did you go through? And how did you tell your mom and your
yeah.
parents and your family, your kids?
I was sitting out in the parking lot. And it was early in the morning, about 9:30, 10 o'clock, and I had a boatload of patients waiting for me in the office. And my fiance and Darvin and Karen were by my car, and they were like, let's go home. Let's go have some breakfast. And so I said, okay, I'll have some breakfast, but then I got to go to work. And they go like, go to work. And I just thought to myself, some might say it's pragmatic, foolhardy, but I think sometimes when you get that kind of news, for me, I felt I needed to just continue being busy and not idle busy, but the work that I had, because I thought, I don't know how much longer I'll be here to continue being a doctor. I don't know if I can be a doctor after I finish um, with breast cancer. So I thought to myself, you know, let me keep working as much as I can until I can't anymore. So after I left there, I went to work and I asked my fiance to call my entire family together, my brother, my sister, my mother, my father, my good friend David, and my sister-in-law, and we all met at my house. And I told everybody at the same time, because one of the things I didn't want, Corlette, I didn't want people making up stories. And throughout
Absolutely.
my whole journey in breast cancer, I I didn't want gossip, and I didn't want, I haven't seen Dr. Powell, what happened to her? I didn't want even family members, is she okay? What's wrong with her? I wanted everybody to be clear. I had breast cancer. I also was going to be going through quite a bit of treatment for it. And I wanted them to not, no, I didn't want them in denial. No, you don't have breast cancer. It came straight in my mouth. And they got it all at the same time. So nobody felt that they knew something over somebody else, you know,
That's
and I didn't
really
want
good.
and more importantly, I didn't want my family to think of it as a secret. For too long, women walk around with breast cancer and they don't tell their families, and because they don't want to be a burden. And people who love you want to support you. And when you keep that information from them, you think you're doing them a favor, but I think the worst thing you're doing is you're alienating them and yourself from the love and support that you can possibly get. But I made it one thing
Absolutely.
clear too, Corlette, and I want to share this because I think it will help people. I told everybody I don't want to hear any negative stories. I don't want to hear who had a bad experience from whatever treatment I choose. I didn't want to hear how terrible it can be. I gave the ground rules for the type of communication I was going to accept throughout this journey because I knew I had to be in a state of mind for healing. So if I told everybody, if you weren't going to talk to me about healing and wellness, don't talk to me.
That's
And I was
fantastic.
really clear. And I think it's important for anybody, whether it's cancer or any terminal illness or any kind of condition, that you set the mindset that you want to be in. And it's weird and it's different. I didn't cry up a storm. I didn't make a big deal about it. I got resolved because of my years in knowledge in breast cancer, but more importantly, because you don't get something that turns into something else and it'd be nothing. So
Right,
ladies,
right.
if you're out there and you got a nothing and all of a sudden you have this big old mass on your chest, girl, stop
I,
lying to yourself. It's
I know.
real.
Absolutely. It is real. We got
It's
to
real. The
fix it.
tumor.
Well, you and I are Virgos, so when we have a problem, we need to find a solution. We don't stay stuck in the problem. We identify the solution and we go and fix it. And
Exactly.
that's exactly what you did.
Yeah.
And what I love is the fact that you brought your entire family together to
Yes.
tell them all one time. Because
Correct.
can you imagine calling this person, calling that person? You have to
Whew.
repeat the story 10 times.
Exhausting and emotionally draining. And one thing I know, you have to have all your fuel and reserves together going through a cancer journey.
Absolutely, absolutely. Wow. So this has been an eye opener, and I hope someone out there is listening, because the most important thing that I heard you say, mammogram is important. You got your mammogram, and if you did not pay attention and did not identify the lump in your breast, that the situation would have been different. We want to encourage women, get your mammogram, do self-examinations. And the the way that you communicated to your family was fantastic. Everyone does it differently, but that worked for you and that worked for your family. So, Dr. Powell, I thank you so much for sharing this week your how you identified this breast cancer journey, how you found out, how you told your family. Next week we're going to have you back because we want to hear what options you have for treatment. What options did the doctor say you had for treatment of your stage 2, stage 3 breast cancer?
Yeah.
So we're looking forward to having you back next week. Do you
And
have
before
any
you go,
final comments before we jump
yes,
off? Yeah,
I do have to make that comment. It's the breast a mammogram is so important, but nothing beats you knowing your body, you examining your bodies. And ladies, stop the I'm not touching myself. You've taken a shower, soap up those breasts that you have and feel them, because more masses are found by individuals than by any doctor or any institution. So please
absolutely.
check yourself on a regular basis and don't be afraid of finding anything, because I know the majority of cancers now can be cured. So please don't be afraid to look.
Fantastic. Thank you so much for joining us this week, Dr. Michelle C. Powell, sharing her journey with breast cancer. We will see you next week, where she will talk about the treatment options that she was given by her physicians.
Yeah.
Again, thank you to our guest, my dear friend, Dr. Michelle C. Powell, for being our fantastic guest today. We will see you next week. Thank you for joining us. Voila!
I'm Kevin Harrington, an original shark from Shark Tank. DG Incorporated provides coaching services to help entrepreneurs open and grow assisted living facilities and build economic wealth. Visit their website to learn more.